All right, according to a study by Colgate, more than 30 million people deal with anxiety when it comes to going to the dentist. Here to give us some tips to make it easier to get our kids to go to the dentist from Tri-City Children's Dentistry is Dr. Angelo Vasquez. Dr. Vasquez, thanks for joining us.
Thanks for having me. Appreciate it.
You are a pediatric dentist. The only patients you have are kids.
That's correct.
What is your best advice for when it's time to take them to the dentist?
Most first thing is starting early. So American Academy of Pediatrics Dentistry recommends that you start by age 1 or no later than within 6 months of the eruption of the first tooth, which is usually about 7 months of age. So, starting early helps to kind of bring regular visits to the dentist, and that way they're more acclimated, comfortable after a bunch of times. So yeah.
And you talk about the importance of a pre-appointment visit, just to meet the doctor, and how does that
definitely. So meet and greet, complimentary visit to the dentist, just to put a face. You're like, hey, we're going to go see the doctor again, or we're going to go see the staff again. That way, so the environment's friendly to the child. They're used to it, and they're like, okay, it's just another trip to the dentist.
So what do you do to make it friendly? A child's meeting you for the first time, and they're really nervous and apprehensive. What is your method?
Sure, there's different techniques, like just kind of go to their level. If they're a little guy, just kneeling to their level, like, hey, let's talk. Here's the toothbrush. Let's play some games. Show me how you brush your teeth. Just keeping it positive. We do some tell show do. Here's the mirror. Here's the tooth mirror. Here's the tooth counter. This is what we're going to do the next time. So that way they can see the instruments, and they're like, okay, that looks pretty simple. I can do that. So you're telling them about it. You're showing them about it, and then like next time we're actually going to do it. So that's tell show do. That's one of the behavior guidance techniques that we use.
So you just make it warm and welcoming and fun for them.
That's right. So it's the staff, the environment. There's like TVs on the ceiling. There's toys. There's video games. So that way they see it's a positive, safe environment for them.
And you also talk about using language, because we say things like cavities and tooth decay and stuff like that. But you get away from that.
Yeah. So I tell parents, I was like, no 4-letter words like SHOT, HURT, PAIN. So we use tooth whistles to clean your teeth. We call it, say, sugar bugs instead of cavities. I give pushes instead of the SHOT, things like that, just so they're like, okay, that sounds easy. The next time, okay, you're going to get a push, you're going to hug around the tooth, and I'm going to whistle away that sugar bug. Quick and simple.
Call it a sugar bug.
That's right.
And you don't use words like, it's very important, I can understand that, words like hurt and pain and things like that.
That's correct. Yeah, so, it's all about, presenting and transfer of emotions. Sometimes parents inadvertently kind of transfer that to the kids just because of their previous experience at the dentist. So, we want to start off on the right foot with that positive experience, so that we're not saying, oh, hey, you're going to get all this and that at the dentist. Like, no, this is easy, fun stuff, and, just going to count some teeth, a little push, hug, and like, we're all done. That was easy. That's fun. I'll see you next time. Yeah.
As a matter of practical application in your practice, I want to take you back to what you said at the beginning. You said it's recommended at about a year of age, they go for the first time.
That's correct. So
what are you looking for when you have a 1-year-old? Is it just gum health? Is it that simple?
It's a little bit more of that. A lot of it, too, is like anticipatory guidance, like, oh, which teeth are erupting. And first and foremost, hey, we have to actually brush teeth. We're talking about nighttime feedings for children, trying to kind of wean off by age a year, brushing after the feeding, just in terms of prevention. So we want to start a lifetime of preventive oral health, versus actually fixing things. So that's the most important thing, is preventive visits, quick, short, well visits. Just as, you take a child or a baby to the pediatrician for a well baby visit, we want well tooth visits from the first time.
Boy, I would have loved to have you for a dentist when I was a little kid. Do you still have the toy chest? That's all they said to us is, okay, if you're good, when you get out of the chair, you get to pick a toy.
We have a toy chest, and we have a claw machine, and a little, actually, speaking of sharks, we have a little shark machine, so it's like the crane machine. So, yeah.
They got to work for their toy.
They got to work it for it, so it's pretty fun seeing their faces when they try to get something.
All right, Dr. Angelo Vasquez, thanks for coming in this morning.
Thanks for having me.
Great
appreciate
stuff.
it.
Really appreciate it. Yeah. It's a beach.